Hello, my name is Kathleen Smith and I work with the Learning Disabilities and Autism team. I'm here today to talk about our care bag pilot, which has been funded by Leeds Hospital Charities. The care bags have been designed to help any adults with learning disability or autism when they are coming into the emergency department here at Leeds Teaching Hospitals Trust. So it is a simple tote bag that is given to any patients that identify as having a learning disability or autism when they come into the emergency department. The bags were designed by our service users via a competition that we put out on social media. The intention of the bag is to help our patients cope better with the environment of the emergency departments. We know from previous audits and patient feedback that our patients tend to struggle. The emergency departments can be very stimulating with lots of noises, lots of lights, and also the unpredictable nature of the waits and the treatments. So the idea of the care bag is this is given to the patients as soon as they enter the department, and it will help them manage that environment better, and it stays with them wherever they are in the department. So any staff member can give out the bag as soon as it's identified that somebody has a learning disability or autism. The bags come with a little tag on them, which the staff member giving it out then puts their NHS number on and sends to us as the Learning Disabilities and Autism team. It means that we can then see what happened to that patient, see if they're admitted, make sure they've got the right clinical alerts on their electronic records, so that if they come back into the hospital that we know about them, and also means that we can follow them up, offer them a health passport, and make sure we've got all the right information about them. So inside the bags we have kind of three different aspects we're trying to do. So we have some patient information, an easy read friends and family test, which is how we get feedback from our patients on the services we provide. We have our team leaflet, again easy read version for our patients, and then we have two information leaflets, one specifically about the bags and then another about the emergency department, who you might meet, what treatments you might have, all in easy read format. So then we have some items to help with the sensory environment. So we have some noise cancelling headphones and we have an eye mask. So to help reduce the stimulation from the lights and the sounds within the department. And then we have a range of items to help with occupation and distraction. So we have a puppet, a chewable bracelet, and a stress ball. All single use. And last but not least, we have a mindfulness colouring book and colouring pencils. All designed for single patient use. The items stay with the patient wherever they travel through the hospital and can be taken home and hopefully brought back in on their next visit to help them manage the environment better. Since the launch in April, we've given out nearly 100 bags. We've managed with the tagging system to track over 70% of them, which has meant that we've added the right alerts to over 50 new patient records. We've followed up 12 patients that were admitted that we might not have otherwise been notified about and supported them as inpatients. And we've received 98% positive feedback on the bags. Staff saying that they love giving the bags out. They love talking through the bags and the items of the bags with the patients. They can really see the difference they're making in the department, especially in the waiting areas. With some staff even saying they're a complete game changer. We've had feedback from patients as well. Patients saying they can't believe the generosity of the bags. they can't believe the standard of the items in them, that they have meant that they've managed to cope with the environment better. They've actually, instead of being so stressed that migraines were, that they had migraines, or that actually by the time they went to speak to a clinician that they were non-verbal, they've actually managed, because of the stress ball, the colouring, the distraction therapies, they've managed to be able to talk and be able to stay in the department long enough to be seen. We worked closely with Leeds Hospital Charity to, they identified an innovations grant for us, which we could apply for, and they helped with the application process of that. And Leeds Hospital Charity have worked with us throughout to see how we can secure ongoing funding to keep the pilot project going, hopefully in the longer term.